Hi to everyone. We are medical students of the Universidad Autónoma de Durango, Campus Monclova, and for this period, as our final project of Medical English 2 with the teacher Omar Coronado Contreras, we are going to talk about the building healthcare terms, and this team is incorporated by my classmates Manuel González Arriaga, Cristina Isabel, Quintero and their server, Saúl Ernesto Cerda Fuentes. To start, we are going to talk of pathology. To understand what pathology is, we need to know two very basic terms. These terms will be health and disease. In concept, we have that health is a state of physical, mental, and social well-being with the ability to function. And disease, in concept 2, we have that is an alteration of the physiological state in one or more parts of the body, manifested by characteristic signs and symptoms. In this picture, we have a healthy person preparing or eating healthy food. Under this person, we have also an unhealthy person sitting in his couch, and as we can see, he is eating unhealthy food. All of these patterns will going to take you a state of disease. Once we have a disease, we say we will have to manifest some signs and symptoms that will be characteristic of one disease of a pathology. And in concept, we have signs and symptoms are both signs of injury or disease. A sign can be seen by another person, perhaps a loved one, a doctor, a nurse, or other healthcare professional. The difference in between a sign and a symptom is that a symptom is what a person is experimenting, although it might not be easily seen by other persons. In some signs and symptoms, we have that if a patient goes to an hospital and we see and we will have to ask what is going with you, and they will answer, I have a headache, a stomach ache, or dizziness. Yeah, and the difference, we may not ask a person to notice what is going with him. We can see he have a fever, he might have a cold, and in case if we have a little baby with diarrhea, we don't have to ask what is going with them. I mean, we have not to ask what is going to you, what is going with you. And this is the difference with signs and symptoms that will be characteristic of a pathology.
When the patient is feeling sick, they should go to the doctor to have a diagnosis. A diagnosis is a disease or condition named after evaluating the patient. The doctor can evaluate signs, symptoms, and clinical history, along with possible test results and imaging procedures. The diagnosis can be considered in two ways, acute or chronic. An acute diagnosis is one that begins abruptly and severely, and ends after a short period of time. The causes of these infections are foreign agents like virus, bacteria, and other microorganisms. Some diseases might even appear due to accidents and misuse of medication. The prevention might differ with the nature of the disease, so you should have personal hygiene, wash your hands, and use a mask. After reaching a diagnosis, the doctor gives the patient complete information about the disease and also gives a prognosis to establish a treatment. Prognosis is the prediction of the probable outcome of the disease. This is based not only in the condition of the person, but on the usual course of the disease as others with the same condition or disease have experienced. In other words, prognosis is the conclusion about what the patient's health problem or the future holds for the patient. This prognosis could be excellent or poor. This depends on the disease.
Now I want to talk you about a very important aspect to diagnose a patient. I'm talking about diagnostics procedures. Diagnostics procedures, it's very important to the doctor for confirm their diagnosis. So we are talking about a clinical intervention, a type of test or procedures very useful for the doctor, used to help diagnose our disease or condition. We have an examples of them like mammograms, colonoscopy, laboratory tests, x-rays are examples of diagnostics procedures or diagnostic tests. There are over 110 diagnostic tests or diagnostics procedures that currently in use. There are either in detecting disease and for monitoring its progression in the patient. Moreover, diagnostic tools and equipment are also used in guiding treatment and evaluating its effectiveness. We have to consider that diagnostic tests are either invasive and non-invasive. The type 1 invasive diagnostic testing involves puncturing the skin or entering the body. Examples of them are taking a blood sample, biopsies, colonoscopies, and we have the other type, non-invasive diagnostic testing, that does not involve making a break into the skin. We can mention an example of them. We have X-rays. Radiographies or X-rays use radio waves to create images of the bones and organs. X-rays are usually the first requested medical imaging procedure for the doctor. Another of them, we have MRI, a highly advanced diagnostic imaging procedure that creates images of the inner structures of body without the use of radiation. And is mentioned like magnetic resonance imaging produce highly detailed images. Another of them, finally, we have ultrasounds. These use sound waves as traducer and a computer to create images, more details of the internal organs. It is the most well-known as a tool used by obstetricians frequently, but it has more application than that. It's cheap, quick, and non-invasive. It's important to mention. Okay, we will have a little different suffix to identify these procedures or these diagnostics procedures, like the suffix ectomy, that means excision, like hysterectomy. We have the other one that graphy, the suffix graphics, meaning process of recording, like tomography. Another of them, we have the suffix metry, that means measurement, like audiometry. We have the suffix scopy, that means a visual examination, like endoscopy, colonoscopy. And we have the other one, a suffix like stomy, that means new opening, like colonostomy. We have the suffix therapy, that means therapy, like physiotherapy. We have the suffix tomy, that means incisions or process of cutting, like colonostomy too. And we have the suffix tripsy, that means process of crushing, like lithotripsy. The last suffix are very useful therefore describe the therapeutic interventions. Therapeutic interventions meaning the healthcare professional will assign treatment to correct the disorder or illness, may consist of a variety of complementary and alternative medical therapies. Interventions can be classified in two types: preventive intervention and therapeutic intervention. Preventive intervention are those that prevent a disease from occurring, and these reduce the incidence of the disease in a new patient. Therapeutic interventions are those that treat or postpone the effects of disease when once it's underway, and this reduce the case of fatality rate or reduce the disability or morbidities associated with the disease. Examples of preventive interventions, well, we have vaccines that are so important actually, like vaccines COVID-19. And another one of them, we have nutritional interventions like diets, like balanced diet. We have even drugs for prevention or disease fatality. And examples of therapeutic intervention, well, we have rehabilitation, we have treatment of disease, and also we have control of chronic disease.
When the doctor realized the therapeutic interventions, they use some instruments, so we have some suffixes used to describe instruments. The first suffix is graft. The meaning of graft is an instrument or machine to record. An example is the cardiograph. The cardiograph is an instrument used for recording the heart sounds. And then we have the suffix tone. The meaning is an instrument to cut. An example is the osteotome. The osteotome is an instrument used to coat wounds. And then we have the suffix meter. Meter means an instrument to measure, and an example is the tympanometer. The tympanometer is used to measure the function of the tympanic membrane. And also, we have the suffix scope. The meaning is an instrument to visually or aurally examine. An example of a scope is the fetoscope. The fetoscope is used to listen the heartbeat of a fetus. And finally, we have the suffix gram. The meaning is an instrument used to check some corporal activity. And an example is the electrocardiogram. The electrocardiogram is an instrument used to check the heart rhythm and electrical activity.
And that was all for us with the topic Building Healthcare Terms 2 in the English medical class as our final project. And in conclusion, we must mention that we as a doctor in progress need to continue preparing in all aspects, because we will not always treat patients who speaks only Spanish. So thanks for watching, and remember that we will be ready and prepared for take care of you and your family.